Symptoms of schizophrenia. According to the DSM-5, there are two different types of symptoms for schizophrenia. They are positive symptoms and negative symptoms. A. Positive symptoms. These behaviors are in excess of an addiction to the normal thoughts or behaviors of an individual. They are as follows. First, hallucinations. Hallucinations refer to false perceptions in the absence of stimulus. It means the individual experiences something even when there is nothing present. For example, even if there is pin drop silence and yet the individual can hear someone talking to him or her, then it is auditory hallucination. Similarly, there may be visual, tactile related to touch, olfactory related to smell, gustatory related to taste, or may be related to internal sensations of the body. Second, delusions. Delusion occurs when an individual has a belief which is false, but the individual is not ready to change it in spite of clear evidence contrary to it. For example, the belief that somebody is conspiring to kill me even when there is no one who is making such plans. Third, disorganized speech and loosening of association. The individual's talk is unrelated to each other. Like he/she may use useless word or may jump from one point to another, which has no connection to the first. Fourth, disorganized behavior, bizarre movements. The individual behaves in very strange manner, like doing the same act for hours together, screaming without reason, running here and there without any purpose, attacking or biting someone, undressing clothes in public places, etc. Fifth, incongruent affect. Here, the emotion expressed by the individual does not match with the situations. For example, the individual cries in happy occasions and laughs in sad occasions. B. Negative symptoms. Negative symptoms lead to low levels of functioning and so the quality of the life deteriorates. Generally, negative symptoms of schizophrenia does not improve much with treatment. They are: first, diminished emotional expression. Second, lack of initiative or enthusiasm. Third, diminished and reduced speech. Fourth, anhedonia, which is no experience of deep positive emotions. Fifth, asocial, and sixth, apathy. Sometimes both positive as well as negative symptoms can be seen in schizophrenia patients. If positive symptoms are seen for 1 month or longer, or if negative symptoms are seen for more than 6 months, the person is diagnosed having schizophrenia. Activity 8. The movie A Beautiful Mind is on John Nash, a mathematician who was diagnosed with paranoid schizophrenia, and how he copes with disorder. In 1994, he was awarded Nobel Prize for Game Theory. Watch the movie and discuss it with friends. Identifying and treating psychological disorders. So far, we have tried to understand a few of the psychological disorders. After this understanding, few questions inevitably pop up in our mind. One such question is whether there are any ways you can easily identify people with mental disorders at an early stage. The answer to this question is yes. There are a few signaling signs that can help one to identify individuals who may require help of an expert in mental health. These are called red flags. Red flags for various disorders are generally used to identify people in need of professional help. If you carefully study all the symptoms of various disorders, you will realize that there are many symptoms which are common among many disorders. If you find such symptoms in any individual, find out if it satisfies these 3 requirements. The first is it should be for a considerably long period of time. Second, find if symptom has become more severe or serious over a period of time. Lastly, find if the symptom has created any problems in the life of the individual or not. If the answer for all three is affirmative, it is likely that the sign indicates the beginning or existence of psychological health problem. Keeping all these considerations in mind, study the signals indicating need for professional help given below. Signals indicating need for professional help: inability to concentrate, inability to sleep well, various physical complaints, uncontrollable and frequent bad thoughts, too intense uncontrollable negative feelings, fear, anger, sadness, worry, etc., severe confusion, memory loss, loss of interest in activities and friends, odd or irrational statements or strange use of words or way of speaking, self harm, and signs of self neglect. Another question that immediately follows once you have identified the individual in need of professional help is whether there are any ways such individual can lead a normal life again. Fortunately, the answer to this question is also affirmatively yes. There are various treatment modalities that can be helpful for different disorders. These treatment strategies range from pharmacotherapy, which is drugs, to various psychotherapeutic techniques like rational emotive behavior therapy, humanistic therapy, gestalt therapy, interpersonal psychotherapy, family and couple therapy, etc. It is beyond the scope of this book to narrate them even in nutshell, but one note of caution needs to be mentioned here. If you find any individual having benefited with one type of therapy, it does not necessarily mean that the other individual also will benefit from the same therapy.